Tell me when to go.
Ready? Go.
Hello, everyone. Our group presentation today is on Neisseria gonorrhoeae. I'm Angie Timms, and I will be covering transmission.
Hi, my name is Annie Pendergast, and I'm going to be doing disease prevention, treatment, diagnosis, and the slide on additional information about gonorrhea.
Hi, I'm Carly Fazenden, and I have diagnosis and signs and symptoms of gonorrhea.
Hi, I'm Callie Joseph, and I have pathogenesis.
Hi, I'm Mackenzie Mead, and I have structure. Okay, so the structure of our organism, Neisseria gonorrhoeae, is a gram-negative microorganism that is part of the cocci group and is arranged in the diplococcus formation. So that's 2 cells. Neisseria gonorrhoeae ferments glucose and is positive for the oxidase test. Neisseria gonorrhoeae is a non-spore-forming microorganism. It is non-motile, and the outer membrane is composed of proteins, phospholipids, and lipopolysaccharides. Neisseria gonorrhoeae is an obligate aero, meaning that it needs oxygen to grow. However, it can also utilize anaerobic respiration using nitrate. And gonorrhea is also sensitive to changes in UV light, temperature, and drying, which makes it the perfect microorganism for where it resides in the body. As you can see by the photo, Neisseria gonorrhoeae has many flagella arranged in the peritrachus formation that help with adherence to host cells. And gonorrhea is about 0.6 to 1 micrometers in diameter and forms pinkish-brown colonies. The proteins that compose the outer membrane are known as protein 1, protein 2, and protein 3. The OPA protein helps with phase variation, while protein 3 induces blocking antibodies and is on most Neisseria microorganisms. NTRF is a membrane protein that has to do with structure. However, there is not a lot known about it. And gonorrhea NGO2105 is an autotransporter adherence protein that helps with attachment to host cells, similar to the flagella. And gonorrhea is most commonly found in polymorphonuclear neutrophils of the gonorrhea pustular exudate.
Pathogenesis is the development of a disease. For pathogenesis of Neisseria gonorrhoeae, it is an obligate human pathogen that infects the reproductive tracts, rectum, and conjunctiva through mucosa and the epithelial cells of the human body. The disease invades either the vagina or the urethra and attaches to the pili of the mucosa cells. Around day 4 to 6 post-infection is when the disease tends to have a greater effect. This is because there tends to be a complete loss of ciliated cell activity affecting many physiological importances. Next slide. For the virulence factors, the first one is attachment, which is a 2-step process. For step 1, the pili on the surface of the pathogenic organism binds to the ciliated epithelial cells through specific tip adhesion and binds to the CD46 protein, which are the cells of the reproduction tract. Step 2, after the initial attachment, the organism binds to the human cells through the OPA protein, which allows the organism to bind to other bacterial cells, creating microcolonies. The second virulence factor is the antigenic variation, which has 2 types. Type 1, the variation of the pathogenic organism can change from type A to type B to type C, all due to genetic mechanism in the pilin protein. Type 2, the variations have phases where they jump back and forth to repeat or restore genes or proteins during replication. It is like an on and off switch. The third one is the ability to evade the immune system. It happens through the IgA protease, which is present in the mucosal surface of the GU tract. IgA protease transpires when the host bacteria releases a protease to digest S-IgA. And the fourth one incorporates human sugar celiac acid into LOS and OM. In serum-resistant strains, the LOS will suppress the activation of the complement, which is the ability to stop the infection. People who have a C6 to a C9 deficiency have an increased risk. Next slide. The effects of this this disease has on the body when the epithelial cells are attacked are, for men, this disease when the inflammatory response leads to urethritis, whereas in women, it leads to cervicitis. In women, infection may progress into the uterus, fallopian tubes, and ovaries, which can cause PID, thus resulting in sterility or ectopic pregnancies. In both men and women, this pathogenic organism can infect the liver capsule, causing Fitzhugh-Curtis syndrome, and can invade the submucosa and enter the bloodstream, which can collect in the synovial fluid, resulting in septic arthritis. And in neonates, it can inoculate the conjunctiva through the birth canal, leading to ophthalmia neonatorium, which is high risk for blindness. Next slide.
Disease development. Aftermath of the infected host. Gonorrhea is a highly infectious bacterium that can infect joint cavities, mouth, and the eyes. It is highly adaptive and can change its mode of action in the presence of the host serum, making it highly infectious. Gonorrhea, specifically in the female reproductive system, compromises the lining of the reproductive tract and breaks cellular bonds. Signs and symptoms. Gonorrhea is hard to diagnose as many go without symptoms or it is taken for a yeast infection or UTI, more common in women. Specific signs and symptoms for women. Pain during sexual intercourse, urge to urinate more frequently, heavier periods, and spotting. Specific signs and symptoms for men. Swelling or pain in the testicles. Some general signs are pain and burning when urinating, fever, sore throat, and abnormal discharge. Signs and symptoms continued. Symptoms for a rectal infection of gonorrhea include discharge, itching, soreness, painful bowel movements. Because gonorrhea is hard to diagnose due to being asymptomatic, women specifically are more at risk for complications from the infection. Cytopathic effects, any short or long-term effects on host cells or tissues. If left untreated, gonorrhea can have permanent damage to the reproductive organs, resulting in several things. Long-term effects for women include chronic pelvic pain, PID, risk for ectopic pregnancy, infertility. Complications for men, there aren't any long-term effects, but they can suffer from epididymis, swollen testes, as well as the tubes that carry semen.
Neisseria gonorrhea is spread through vaginal, anal, or oral sex. A pregnant woman may also pass it on to her baby perinatally during childbirth, in which case the baby would be born with ophthalmia neonatorum, or conjunctivitis of the newborn. This can cause blindness in newborns, which is why topical erythromycin is administered to the eyes of all newborns upon delivery, if the parents are willing. Next slide, please. In addition to male and female genital organs, the eyes and pharynx may also become infected if they come into contact with infected secretions. Here's a picture of gonococcal conjunctivitis and pharyngeal gonorrhea. Next slide, please. Transmission between hosts relies on sexual networks to spread the pathogen from the core high-risk population, where the majority of cases occur, to the fringe or medium risk group, who then transmit it back to the core group. This core group or high-risk group includes people with multiple sexual partners and those who have unprotected sex. So 15 to 24-year-olds account for half of all new STD infections, and anyone who is sexually active can get gonorrhea. Next slide, please. Ejaculation does not have to occur for gonorrhea to be acquired or transmitted. However, it is more easily transferred from men to their partners because their ejaculates contain a high number of bacteria. Next slide, please. And gonorrhea uses different cellular receptors and signaling pathways to infect men and women. And gonorrhea sialylates the terminal N-acetylactosamine present on its lipo-oligosaccharide, or LOS, by acquiring CMP nu5AC upon entering the human cells during infection. This renders the organism resistant to killing by complement in normal human serum. Infection in men is dependent on the availability of a terminal galactose residue on the gonococcal LOS. Next slide, please. In contrast, gonococcal invasion of primary cervical epithelial cells is not affected by cellulation of the LOS structure. Thus, N-acetylactosamine residues on the LOS must be free of new 5AC in order for N-gonorrhea to bind to and enter urethral epithelial cells during infection in men. Women with gonococcal infections have levels of sialidases present in cervical vaginal microbiota that can result in desialylation of gonococcal LOS, which enhances successful transmission from men to women. Next slide, please. A 50% infective dose of about 1,000 bacteria has been determined based on experimental urethral inoculation of male volunteers, and I couldn't find data for females. Gonorrhea is an obligate human colonizer and therefore cannot survive outside its human host. The bacterium requires a warm, moist environment such as the mucous membranes of the urinary tract, the vagina, or the anus, in both men and women. Next slide, please. Even without symptoms, gonorrhea can still be passed on. Having infection once does not provide naturally acquired active immunity. It is possible to contract gonorrhea repeatedly. Next slide.
The best ways to prevent gonorrhea are to not have sex, use protection like a condom for vaginal, oral, or anal sex, and have one exclusive sexual partner who does not have gonorrhea. Next slide, please. The treatment for gonorrhea is antibiotics. The different types of gonorrhea are genital and oral. For genital gonorrhea, there is cetraxone. The dose is 250 milligrams, which is injected into the muscle for a single dose. It's a part of the cyclosporin drug category, and the CDC now recommends a 500 milligram dose IM. There is also erythromycin, which has a 1 gram dose taken orally. It's a single dose. If cetraxone isn't used or at disposal, cefixime is used, and the dose is 400 milligrams, which is taken orally. It is also a part of the cephalosporin drug category. For oral gonorrhea, a throat culture is used to identify the disease. The side effects for these treatments are upset stomach, rash, allergic reaction, and kidney damage for the cephalosporin drug category. For erythromycin, the side effects include upset stomach, nausea, diarrhea, and vomiting. Because reinfection is so common with gonorrhea, the CDC recommends that women and men who have had gonorrhea be tested 3 months after this treatment. Next slide, please. Disease diagnosis. The best ways of diagnosing urogenital gonorrhea are using a urine sample, a urethral for men, or endocervical or vaginal for women specimens, using nucleic acid amplification testing, or NAT, and using a gonorrhea culture, which is a test that requires endocervical or urethral swab specimen. For diagnosing gonorrhea contracted during oral and or anal sex, pharyngeal and or rectal swabs specimens are used. Next slide, please. So here's some additional information about gonorrhea. If untreated, it can increase the risk of a person transmitting or acquire HIV, which can cause AIDS. People that are at risk for gonorrhea are sexually active teens, young adults ranging from 15 to 24 years, and African Americans. The CDC recommends yearly gonorrhea screenings for women under the age of 25 and older women who have had multiple or new partners or had sex with a person who has a transmitted infection or STI. There is a chance of getting white, yellow, or green urethral discharge from gonorrhea. More symptoms include discharge, anal itching, soreness, bleeding, and painful bowel movements. Next slide, please. Thank you so much. Here are citations in MLA format.